You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And my first guest says nobody should be wearing a loose-fitting denture. Now you can get brand new upper and lower set of teeth supported by dental implants. With us, we have Philadelphia's go-to implant dentist, Dr. Keyur Patoliya. Dr. Patoliya, welcome to the program.
Thank you for having me.
Now you have a stack of photos, so we're going to get to as many of those as possible. We've also had your partner on the program, but for people that don't know your practice, who is the typical patient that you see that comes in for dental implants?
Now, we see pretty much anybody, people from as young as 18 to people older like 1995. So we see
95-year-olds are doing this?
Yes, we do, and I'll show you a picture. But we see, people of all walks of life. But if I had to, sort them out into two categories. Now, category number one would be people, they have lots of bad teeth, bad teeth and gum. Now, they have, they have bleeding gums, they have cavities, they have bad breath, their teeth are started to flare out, and, their teeth they are losing tooth like one tooth at a time. And they have been told with, with another dentist that they cannot save their teeth anymore, and they need dentures. Now, people come to us. So
they come to you because they don't want a denture?
Absolutely, they don't want dentures, so we give them the fixed teeth, supported with the, dental implants. They don't come out and they are happy. Category number two would be patients in the dentures. Now, those are the people I think we can, help them the most. So
you said it's hard to get those people in.
That is true. That is true because, so many times they don't know what are the options because they don't come to, dentists anymore. Now, they have, probably loose-fitting dentures and, they are putting a lot of glue, they are gagging, and but, they will not come because they think, why I have to pay again for those, reline of the dentures. People, me and you will not know, but the people they are wearing dentures. If you go, right, where it started. So usually, those people it starts into their teens. Now they have cavities after cavities. They have crown, root canal, failed root canal. They have bridges, broken crowns. They go to endodontist and root canal done. They go to periodontist. They have gum treatment, bleeding gum issues solved. So they have paid nickels and dimes, a lot of money, and
then they lose all their teeth.
And yes, absolutely.
So they don't want to go back.
They don't want to go back, and basically when they say when the dentist says we cannot save your teeth, you have to be in denture. In back of their mind, they are relieved. They think money paid is over. We don't have to visit, the trips to the dentist and specialist is over. They don't have to worry it anymore. Now, they, first week or maybe 10 days a month, they will wear a denture. They are not comfortable, but they will not complain. The reason
they just adapt to it.
They will adapt to it because human being, nature, we learn, adapt. But if you think they are not eating hard food, they are not eating the food they're supposed to eat, like a tough texture food, right? So basically they are lacking, all that minerals, vitamins, and proteins that they because they cannot eat like vegetables or fruits or meat. Certain vegetables, they will eat some. So we can give them the fixed teeth. They do not come out supported by dental implants, and we can change their life.
Okay. Now, you brought a stack of photos.
Sure, yes.
And now, correct me if I'm wrong on this one, that in your office, I guess how dental implants are typically done is you go to one doctor that does the surgery, another doctor that puts the teeth on top, and then they go elsewhere to get it cleaned. You do all three parts. Is that why you do it so quickly?
Yes. So we do everything under one roof. Now we have, a team. We have excellent, we have people with excellent skill. We have technology. We have, 3D printers. We print the teeth right in the next room.
So you digitally print the teeth?
Absolutely, yes.
Right there?
Right. When they are done with the procedure, when they are done with the surgery, 45 minutes, then we can give them the teeth. So It's under one roof. And again, an advantage is we do not, I have an in-house lab, so I do not have to rely on the third-party lab. Not to mention, we don't have to pay, the lab fees, which is we save the money, we pass it on to the patient.
So it's faster, but it's also maybe less expensive, the fact that you do it all right there.
A lot faster because we have the technician sitting right in front of me. If I have to ask something, change something, is right there. I don't have to contact them. And do not get lost into the conversation.
So photos, let's jump into some of the photos. Now, we should mention, and we're talking about dental implants, all of these photos, I asked you to bring photos of people that would have had a denture, but now they have new teeth supported by dental implants. So what are we looking at?
So here is my first patient.
Okay.
So if you notice him, he's not smiling, he's hiding his face. And you will see the after picture and you will know how good it can be. Now, he has no teeth, he cannot chew his food. And it's like, it affects their confidence. It's, literally affects their life. Now,
So that's his best smile he'll give you.
That is true, yes.
Okay,
and in a one day, we removed his teeth and we were able to give him a smile. Look at the before and after. Would you say he looks more younger?
Yes, he does.
Would you say he looks more confident?
Yes.
More youthful?
Yeah.
More friendly?
Yeah.
So before he came to me, he had like a tough time eating and chewing. He couldn't chew food and it was affecting his life. He has actually stomach issues and stuff. Now we gave him like a brand new teeth. Now he's eating corn on the cob. He's eating healthy food. He's eating popcorn, not to mention he's eating carrot. He's eating all the food that he's supposed to, and that he liked it. So we resolved his stomach issues.
When I met you over the phone, you were talking a little bit like that. And it almost sounded like an exaggeration, but when I look at this before and after photo, you're right. You would have an impression of him on the before, and then the after, he looks like a different guy, like as far as approachable and kind and things like that. So good work. We have time for another one?
So here is my second patient. Now, her complaint was she do not like her teeth. Now, it's not we have to remove all of the teeth, like not all the time. Sometimes we save, patient's teeth.
Okay.
So we went over the options. We went over what's the positive and negative about the treatment. Look at the after. Now, they look like real teeth. I mean, I can tell when the teeth are fake. Those teeth fit into her face. Look at the teeth. They are follow the lip. They are follow the smile line.
So this is done on a computer ahead of time?
Yes, we do. I mean, we do, so much of the pre-planning ahead of the time. Now we have the smile design work going on. So it is actually done like a lot before. Now, we do some of the model surgeries before just to get faster on the day of treatment.
Okay.
Now let me show you my next patient.
All right.
Now his main complaint was, Doc, can you please get me out of those dentures? I hate them. He's getting ulcers here and there. His teeth are loose, bad breath. I mean, literally this guy, when he, walks in, I did the consultation, he's not even looking up, he's looking down. He is like ashamed of, the mouth. Now,
what are you thinking on that consult?
Back of my mind, I knew that I can change his life and he has no idea what I can do for him.
Okay.
Picture will do the justice. Let's take a look at the after picture.
Very nice. Very good.
So his life is changed. Now he can eat whatever he wanted to. He can, chew, healthy food.
Do they tell you they smile more? Because it looks so much better, obviously.
Absolutely. Now, it's funny. Sometimes when we give them a new teeth, they are still not used to it. They will not smile. But right after having 10, 20 compliments, they are smiling ear to ear.
Is that right? What's it like when they look at their face for the first time with this new look, this new smile?
A lot of times it's wow. We see tears, and it's a joy. We have done a surgery. All the members are exhausted. When we see the tears, when we see they're happy, it's just makes our day.
Now, family members come in, and I think you told me they also get kind of choked up.
Absolutely,
Is that right?
Absolutely, and it's a wonderful moment for them. They haven't seen their face in the mirror like it's totally different person. They think they have changed their life.
So what are the age ranges? Like how old can you be to get this done?
There is no age range. You can do pretty much to anybody. My oldest patient is 91 years old.
I mean, why would a 90-year-old want to do this?
They enjoy food as much as I think we do. They
Even more, maybe, right?
Maybe even more. At that time of the age, they need that nutrition. They need like a good food. Now, when you are retired, you wanted to travel. You wanted to enjoy good food.
Okay.
Tell me, if you are traveling to Europe, maybe Italy, you wanted to try the food. Now, if you are traveling with the dentures, loose dentures, loose fitting teeth, do you think you will enjoy the food? Do you will enjoy
Not
the
as much,
travel?
for sure.
Now, when we do retirement planning with the CPAs, and when we do retirement planning with the CPAs or financial planner, you do not plan to have, you do not plan to travel the world with the loose fitting teeth and the dentures.
So at the top of this show, I said, no more dentures. So you believe that, like the future of dentistry, everybody will have teeth locked in, supported by dental implants. Is that what you believe? Is that the direction dentistry is going?
Absolutely, and I certainly hope so. Like in 10, 20 years, we do not even have to talk about dentures to the patient. I mean, it's not a good option. We see people with the dentures, their functional capacity of chewing food is only 25%, which is not a lot. It affects their physical health as well as their mental health. A true story, by the way.
Okay.
I had a lady who comes in with the husband on the consultation. She's sitting on a chair and crying. And you wanted to know the reason why?
Why?
She went to the church, right? And then she's talking to the friends. In front of their friend, her denture dropped. And it make it like so sad to her. She would not come out of the home.
It's embarrassing.
It affected her mental life. She had depression. Now we gave her a fixed teeth. The teeth supported with the dental implant, they do not come out, and you have to see her face. Now she started going to the church again. Now she is traveling. She is meeting the friends. She told me, I wouldn't invite friends to my home because I'm embarrassed.
Because they couldn't eat in front of them? Because of the bad teeth?
Absolutely. I mean, when they're eating, always with the dentures, food goes underneath. Now you have to get up and clean you have to excuse your friends, I'm going to go to the restroom. Not that they wanted to use the bathroom, they are going there to clean the teeth.
Yeah, but what if you have bad gums, like gum disease? Can you still do this, or the gums are too bad and the implants will fall out?
No, absolutely. And that's actually the best part of the treatment. Now, when you take out the bad teeth, the bacteria, bad bacteria, everything comes out with it. And actually, when we place an implant, now your gums are healthy. So your implants are put in the healthy environment.
Now, are there a lot of people, though, in Philadelphia or even in the state that are either wearing a denture or headed to a denture? I mean, is this like a big problem where you are? Or how big of a problem is it?
Absolutely, it's a very big problem. Now, in United States, there are about like 40 million people that are wearing, upper and lower dentures. If you take Pennsylvania, there are well over 1 million people, they are in dentures. Now, if I had to fill in a bigger stadium in Philadelphia, the Lincoln Financial Field, home of Philadelphia Eagles, we can actually fill the stadium for 16 to 17 times.
Well, why aren't they all doing it then? I mean, if it's so good, what's your take?
A good question. There are about like 4 or 5 reasons why they don't do it. People, they are in dentures. They do not go to dentists anymore, so they don't know about options. Only time they go in if they have cracked tooth or broken denture. So basically, they don't know about options. Let me tell you, life of the denture wearers, right? They were before in the dentures. So they have cavities after cavities. They have root canals. They have crowns. They have crown after crowns or failed crowns. Bridges, they go to the endodontist, they go to the periodontist for, so it's like lots of money spent, to
save the teeth.
To save the teeth. So when the teeth are out, the last thing they wanted to come is come to the dentist, and those are the people we can help the most.
So the struggle is to get those denture wearers back in the door.
Absolutely.
Now, I asked your partner the same thing. If somebody's watching this and they either have really bad teeth that have to be extracted or they're wearing a denture, the day after tomorrow, or let's say 2 or 3 days from now, they could have if you had an opening on your schedule, they could have their new teeth, upper and lower teeth. Is that right? You could do it that quickly.
Yeah, if miracle of the calendar doesn't happen all the time, but yes, typically patient comes in on a day one. We take the CT scan. We go over the options. We start painting the picture of how we can change their smile.
Okay.
How we can make them in a function again. And if patient agrees, day two, they will come in. We take some smile pictures. We take some photos that we use it to create their smile. On the day of surgery, we will do the IV sedation or even deep sedation. And once they are done with procedure, they will have beautiful teeth.
So that could be like 3 appointments.
Absolutely.
You meet them, take the measurements or whatever,
right.
Look at the teeth, and then they get their teeth.
Right.
Very nice, very nice. Is that unusual, or does that happen all the time?
It happens all the time. It happens all the time. So let me show you this next patient.
All right.
She came to me having the gum disease, having the front teeth loose. She literally told me she's not eating apple because she's afraid if she will eat an apple will take out the tooth for her.
Okay.
So in a day, we change her smile. Look at the after picture. Now, the first thing she did when she came to that, she brought an apple with her.
Is that right?
And she bit on apple in front of all the staff, and you can see the tear of joy in her eyes.
So they can eat whatever they want. Whatever you can eat with regular healthy teeth, you can eat with this.
Absolutely.
Can you bite a carrot with the front teeth, or you have to be careful?
No. You can bite the carrot with the front teeth.
Okay. And so now is this one of those things where they regret not doing it earlier?
Yeah, and so many patients, they tell me after the treatment, say, Doc, I think I was a little late in the treatment. I wish I could have done it a lot more sooner. They changed my life, and I wished I could have done it like before, so I could have enjoyed that before.
Do partners do this, or husbands and wives do it? Do they send one in first, and then the other one comes in? Has that ever happened to you?
All the time. Now it's
really
yes, it does. And usually, wife starts the treatment. It's not she is a guinea pig, but I think husband is being a gentleman in so many times, and they let her do the treatment. Now she's smiling, and she's enjoying all the food, and she convinces the husband to do the treatment. And and we have people, they refer their brothers, their sister, their friends, and that's how we have a lot many patients. We can change the life.
I like we joked about it in the green room, but the most expensive part of this procedure is going out to eat all the time and traveling and things like that.
Right. So
is there truth to that?
Oh yes, and actually it's funny. One of the patient is like, say, Doc, you owe me more now. And I said, do I owe you? Or I was confused, but I think she was telling me that she's spending more time going out with the friends, eating dinner, or even traveling. She went to the cruise recently, though. That's why she was telling me that, you owe me.
Is that right? Now, when you are on the consultation and they're telling you their hard luck story about their bad teeth, and do you ever get excited in your mind going, this is going to be good?
All the time.
And can you see the end result? Like, do you feel like, I know what their teeth are going to look like?
Absolutely. I mean, after having all those cases, we actually can see, we can picturize how we can change the smile and what difference we can make. And even we have some technology. We can take the picture of the patient, and we can actually show them how we can make their smile in like 5 minutes.
Oh, so you show them what their teeth are going to look like ahead
Absolutely,
of time?
right before we do that.
And so you could pick like the color, the shade.
Absolutely.
Now, another thing is, you say men have different shaped teeth than women. What do you mean by that?
Right. So usually men's will have broader looking teeth. They may have a pointier canines versus females will have a more curvy teeth. So we can design all of the teeth. I mean the technology is like you dream it, we plan, and we print.
You say these patients will say to you that you've changed their life.
That's not true. Actually, patients change their life themselves.
By deciding to do something.
By deciding to do all the treatment.
Point. Very, very nice. Time for a few more photos.
Now, look at our next patient. She had, her life story is she had bag of dentures she came with. She
A bag of dentures.
Right. She cannot get used to it with the dentures. I mean, she cannot keep it, in her mouth. And she was, going everywhere without teeth. Now, how that was like a big impact in her life. She cannot go to the job interview. She was like so embarrassed. Now, look at the after picture. And tell me, if you interview her, would you hire her?
Maybe, right?
Right. I mean, she looks,
But the bottom line is, so she went around with no teeth. Now she has upper and lower teeth supported by implants. You're saying like 4 to 6 implants, you can give them a full set of teeth that are just locked in there, don't come out.
Right. And
is that what you did for her?
Yes, and as you mentioned, we have people come in and they think it's too expensive. We do not have to put, one tooth implant, like we do not have to put each implant, each tooth and each implant. So we placed about 4 to 6 implants. We do it like strategically, so it shares all the load of the function, and all you need is 4 to 6 implants.
To get teeth that don't come out.
Right. So
how soon can they eat? So when they get the procedure done, how soon can they start eating?
Right away. It's basically, and a lot of those people, they are in the dentures and they actually start chewing like a softer food. Now, when you are getting used to it like a new bike, you do not start running. I mean, you learn how to go, and then once you learn, then you get better, and then you start chewing hard food. So when we place those implants, as time goes, implants get harder and harder, and they start chewing more harder food.
I got to ask you about this: snap in, snap out teeth, which is very common, very popular. At least on the internet, I see it's very popular. You don't like those. Why?
It's not I don't like it. It's my patient who tells me they don't like it. I mean, why would they like those dentures? It's still a denture. I mean, it's a little bit better, I would say, than the regular denture. But again, it has a lot more maintenance. If you will drop it, you will break it. And if the food doesn't taste as well because it's still an acrylic, it's still a denture. So here is another patient.
All right.
And she couldn't handle the dentures. I mean, she came to me and told me my dentures are getting bigger. That's not the case. I mean, it's
yeah, that's right. They do get loose. What's going on there?
Right. So it's because years of having denture, they actually lose the bone, and their face, they sink in. Look at the after. Look at the after photo.
Wow, she looks a lot younger.
Yeah, I would say, yeah. She
like
looks
not even the same person. That could be the daughter of the before photo. I'm saying that respectfully. I mean, it looks that good.
Right. So yeah, she looks like a daughter of the before photo. And good thing about her was she would not do it, if we don't do sedation. So we do like a deep sedation.
Yeah, you're big on sedation.
Yes, we do. I do IV sedation myself, and I have an anesthesiologist.
IV sedation.
Yes, I do IV sedation myself, and I have an anesthesiologist come in, and we had an anesthesiologist for her, and we did the deep sedation in office. That's the only way she's going to do treatment.
So in one afternoon, she comes in with no teeth like that and walks out with upper and lower teeth that don't come out.
Absolutely true. Absolutely true.
We only have a couple of minutes left, and I know you wanted to show these photos. So what's next?
Here is another one. And again, like no teeth, and he wanted to travel, but he said, how I'm gonna travel. Look at the after. Now he's ready to travel. Now he can eat whatever he wants. And here is my next patient. She had a gum disease, very bad smell, and
so when you say gum disease, like a bacterial infection in their mouth that's causing them to lose the teeth.
That is absolutely.
So what do you clean that up?
Yes, and as I said, once we remove the teeth, that infection comes out, and we can place an implant. Look at the after picture.
Okay.
Look at the after picture. Now she's not smiling a lot, but as I said, as time goes, and you would see her smiling year to year.
So you say that like they've gone so many years without smiling, they don't smile very much.
That is true. Yeah, I mean they almost like forgot to smile.
So what? So after maybe 10, 20 compliments later, she'll start smiling.
Absolutely.
Do you see that all the time?
We see all the time.
Like they seem like really serious people, and then 6 months later, you see them on a checkup
Right, and again, some of the life stories what we get is right after, like when we have the 6 months appointment when they came in. Usually we chat a lot, and how life is being changed with the treatment we do, and it's rewarding.
Very nice.
And here is my next patient, a very young lady, but look at the teeth. She has broken teeth and cavities. That's the reason she came to me. She don't want to be in dentures. I don't think that the young people like that deserves to be in denture. Look at my after.
Wow, different. Looks totally different.
With the dental implants, with the dental implants, those teeth are all fixed. They do not come out, and that makes all the life change in that way.
Her confidence must be way up with this type of a thing.
Absolutely. I mean, you can see her, eyes brightening up right after the procedure, and she was like so confident, and she got so many compliments even from the work, and she actually referred me a coworker, and
Nice.
that happens all the time. Here is another patient. She had actually the medications and dry mouth. She could have ended in the denture, but look at the after. Look at the after photos.
Well, she's got to be thrilled with that.
Absolutely, and then we have actually a video testimonial, and she actually literally cried in front of husband. I mean, she imagined her teeth. She pictured herself like that's the picture of the smile she had in her mind. We actually customized her gum. She didn't like the brighter gum, so we customized her gum for that.
Okay, one more. 30 seconds. Very good.
Look at this, my next patient, and she had like he had a partial denture that he cannot wear. And this is the after.
Totally different look.
Totally different person, right?
We are out of time. So let's say somebody's watched this whole thing. They either have really bad teeth that have to be removed, or they're wearing a denture, but they're still scared, or they're afraid, or they whatever reason, they're skeptical. What do you say to them?
Well, I would say there is always a hope. So many times people lose hope, and they have been told nothing can be done for it. But the technology and amazing the amazing technology we have in our office, we can literally help patients. I would say if patient can get out the car, walk into our door, chances are we can help them with the fixed teeth. So come on in, let us take a look. It's a free consultation. It's a free CT scan. Where would you go and having the free CT scan and consultation, and we can actually start painting the picture how your smile would be and how you can function. And
you discuss payment plans with them right there, because Medicare, Medicaid, insurance doesn't really cover this across the country.
And we have 90% of my patients, they actually finance part of the treatment, all of the treatment.
So if they want to make an appointment, do they go online or just call your practice? What do you prefer?
It's actually both. They can do either way. They can call, and they can go to the website.
Okay, good. I want to thank you for coming on the show. Great stuff.
Thank you very much, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.